We welcome you to our module Congestive Heart Failure, HCC 85 from MRA Tips. This module has been developed specifically for MRA reviewers as a refresher on diagnosis criteria, documentation, and coding of congestive heart failure. At the end of this module, the learner will be able to describe congestive heart failure and its cause, distinguish between left-sided CHF and right-sided CHF, discuss the criteria for the documentation of congestive heart failure, identify the ICD-10 codes that fall under congestive heart failure, review the example of the assessment and plan for congestive heart failure. Congestive heart failure or CHF is a clinical syndrome in which the heart is not able to pump enough blood to meet the needs of oxygen and nutrients for the tissues in the body. It usually occurs when the heart muscle is too weak. Other defects can also cause it to stop working properly by preventing the blood from circulating. There are two types of congestive heart failure. First, when it happens on the left side, and second when it happens on the right side. Left-sided CHF is more common. It occurs when the left ventricle of the body is unable to pump blood effectively to the rest of the body. When this happens, the normal functioning of the other body organs hinders, which can cause fluid to build up in the lungs, thus resulting in abnormal breathing. Left-sided CHF can be further subdivided into systolic heart failure and diastolic heart failure. In systolic heart failure, the left ventricle cannot contract normally, thus limiting the heart's ability to pump blood to the other parts of the body. In diastolic heart failure, on the other hand, the muscles present in the left ventricle stiffen, because it can no longer relax. The heart cannot fill with blood between the beats. Right-sided CHF occurs when the right ventricle is unable to pump blood to the body effectively. It is less common than left-sided CHF. There is a possibility that both right-sided CHF and left-sided CHF occur at the same time. But even in that case, congestive heart failure starts with the left ventricle. Any health condition that directly affects our cardiovascular system can be a potential cause of congestive heart failure. Hypertension, coronary artery disease, conditions related to the irregular opening of the heart valves, diabetes, thyroid diseases and certain infections may lead to congestive heart failure. Initially the symptoms include fatigue, swelling of the limbs, weight gain, and an increased need to urinate. In the later stages, irregular heartbeat, rapid breathing, chest pain, wheezing and fainting might occur. In children, poor feeding and excessive sweating are also considered as symptoms of CHF. Congestive heart failure can be categorized into four broad categories. In the first stage, people do not experience any of the aforementioned symptoms during regular physical activity. In the second stage, rapid breathing and palpitations might occur during physical activity. In the third stage, even mild physical activity can cause palpitations and shortness of breath. In the final stage, these symptoms are present even if the person is resting or doing no physical activity at all. There are different tests to diagnose heart conditions, namely, electrocardiogram, echocardiogram, MRI and stress test, cardiac catheterization, etc. Electrocardiogram or ECG records the rhythm of the heart. If it is irregular or the heartbeat is rapid, it can be a warning sign of heart failure. Echocardiogram or echo on the other hand utilizes sound waves to record the structure and motion of the heart. The criteria of the diagnosis of chronic heart failure involves an echocardiogram test. The result of the test should have the LVEF less than 40%. LVEF stands for left ventricle ejection fraction. It measures the amount of blood being pumped out of the left ventricle of the heart with each contraction. The echo result should also indicate elevated levels of natriuretic peptides. Natriuretic peptide is a cardiac hormone secreted by cardiomyocytes into the circulation in response to states of volume expansion and pressure overload, as is the case in congestive heart failure. If the patient is diagnosed with CHF and on treatment, a preserved ejection fraction, F greater than 50%, in an ECHO does not mean the condition is cured or does not exist. It means it is compensated. The ICD-10 codes that fall under congestive heart failure include Code I11.0, which is for hypertensive heart disease with heart failure, with an HCC value of 85. Code I50.22, which is for chronic systolic, congestive, heart failure, HCC being 85. Code I50.32, which depicts chronic diastolic, congestive, heart failure, with an HCC value of 85. And lastly, the code I50.9, which is for other heart failure. Its HCC value is also 85. The assessment and plan should address the diagnosis as current condition and include 2 support indicators. Let's see an example of a progress note for CHF. Patient name: Megan Kelly. Date of service: July 26, 2019. Date of birth: June 19, 1970. Assessment and plan: chronic systolic heart failure. Stable. No symptoms. Continue follow-up with cardiologist. Continue carvedilol 25 mg twice a day. Furosemide 40 mg QD. Control verapamil ER 240 mg daily. Echo ordered next 2 days. Follow up in 1 month. We have reached the end of our short refresher course on congestive heart failure. We gave you a short introduction to CHF, reviewed the criteria for the documentation of congestive heart failure, identified the specific codes and HCC category pertaining to the disease, and finally discussed the assessment and plan for the diagnosis of CHF. Thank you for joining us.